So now focusing a little bit more on the bispecific antibodies. So what are they? And these are drugs that actually are targeting two different areas of the system. So differently than the classic drugs that we have, like the ones that I mentioned before, the pembrolizumab or Keytruda, or the rituximab, also called Rituxan, they're actually targeting only one thing, in this case, the purple protein here in the figure. The bispecific antibodies, they can actually target two different areas. And by that, they can actually attack the cancer cells in two different areas, or they might even attack the cancer cells and bring the immune system together. And I know this may seem a little bit confusing, but we'll dive deep a little bit more. But just to explain that, we have here in this picture, for example, our cancer cell in pink and our immune system cell in blue, and that drug that's a structure that looks like a letter Y is actually getting them together. So to understand how that actually works in our system, I'm going to show these figures right here. So actually, as I said, by bringing the immune system together with the cancer cells, these drugs release a lot of these structures called cytokines. I don't have to go into details, so I'm going to call them our inflammation molecules, those molecules that help create inflammation in our body, and that's going to kill the cancer cells, or as we like to call it, an activation of the immune system. Once it happens, and we can zoom in a little bit more, basically it is like you're grabbing the cancer cells by one hand and the immune system by the other hand and approaching them together, putting them side by side. So basically, these drugs, what they're doing, they're basically telling a patient's body, hey, this is the cancer, let's go and attack it. Another way that sometimes they can do it, which is a little bit differently, instead of grabbing things together, is we know that cancer cells, they're unfortunately kind of smart, and they have many ways and many mechanisms that will make them keep growing, keep dividing, and keep expanding. And sometimes we used to have to do treatments with multiple drugs or more than one chemotherapy, or sometimes combinations of chemotherapy and immunotherapy and many things to actually reach our desire to kill the cancer cells. But with these bispecific antibodies, because they are basically two structures mixed together, meaning that half of it is going to act in one part and the other half is going to act on another part, we can actually attack more of these mechanisms together. So here on this example, we have this drug, the purple and yellow one, that's actually blocking here, as we can see, the yellow mechanism and the purple mechanisms. So it's like you're putting the hands on top of them and telling the cells, hey, let's stop, let's block all of that. And this is another very interesting mechanism that's causing a lot of commotion and a lot of great results in the cancer treatment world. Here is just a quick summary of all the approved bispecific antibodies, and this by no means is a comprehensive list. Currently have over 10 of these drugs that are in practice, so I'm just showing some of the areas where I can use them. So patients with leukemia, multiple myeloma, lymphomas, uveal melanoma, which is a rare type of cancer in the eyes, lung cancer, and the different types of lung cancer, actually, they can benefit from this new medication. And this is an area where we're seeing a lot of evolution that's coming up really fast, or we are also seeing a lot of these older drugs being actually revamped and utilized in different indications. So we expect to see more and more of these bispecific antibodies in the near future, and they are actually benefiting a lot of patients in our clinic day to day. With this, I'd like to thank you all for your attention and conclude this first video of the series. And I hope that you can catch up on the next ones. Thank you.